I did. I'm a pediatrician. I did a sports medicine fellowship in Boston at Harvard, and came back to Ottawa. I work at the University of Ottawa Brain and Mind Research Institute, and I also work for the International Health Advisory Team, which is pretty interesting thing we can talk about later. I'm the medical director for Concussion, Ontario, Pediatric Sports Medicine Clinic of Ottawa, and the Ottawa an Eastern Ontario Concussion Clinic. All right. So just disclosures here. So I do a lot of these talks. And it used to be a very, very long talk. So we're going to give you the Reader's Digest version here about how to, look at pediatric concussions and the mental health kind of issues that go with it. What we talk about here, it might be new to some, but I assure you it's all based on evidence. You'll see lots of slides with studies on it later on. When we talk about concussions, I think it's important to realize that there are different facets of head trauma. So one of it's being concussion, which we'll explain later on. And then you have the more moderate to severe brain injuries, which is, apples to oranges really to what a concussion is. So when there's actually a structural change in the brain, that's one of the diagnostic criteria that will change it from what we consider a mild traumatic brain injury to a moderate. And then you hear a lot in the news about chronic traumatic encephalopathy. So that's the how repetitive concussions over years and years can have an impact on the development of brain. So obviously concussions is different than that, but even those kids and adults, although I only see children, that suffer from prolonged symptoms, something that we used to call post-concussion syndrome, that we don't really call that anymore. We call it persistent symptoms after concussion. That's very different from what a concussion is too, and I'll explain that in a little while. And I do lots of talks for different companies, so they're all there. And yeah, so let's kind of get started here. So the objectives, we're going to talk about what are the four major determinants that influence concussion recovery. And this is something that I've put together, kind of this strategy, this protocol. I've seen close to probably 10,000 concussions in my life, so it's taken me kind of a long time to fine tune my clinical approach. But yeah, we're going to talk about the four major determinants of this. We're going to explain why concussions is more than just a brain injury. We're going to talk about the systemic effects of concussions and how it really does affect every cell in your body. We're not going to go through too much. I'd get an email earlier today just wondering who was going to be the target audience, and I didn't hear back too much of it, but so it was going to be a little bit for doctors, but this will be more for just the general population here. And we're going to talk about some treatments and things that people can do and how to get yourself better if you or one of your loved ones is suffering from a concussion. All right, I always start these talks by asking people if they have any sort of transformative books, any books that they would really recommend, that they had the books that had a big influence on them. One as it relates to how the body responds to trauma for me is a book by Bessel van der Kolk called The Body Keeps the Score. It's a fantastic book. So if anybody's interested in trauma and how it affects the brain and the body, Bessel van der Kolk's book is a great place to start. All right, so I've been a pediatrician now about 15 years, and I can tell you it's significantly changed over the last 7 years or so. And same thing with concussions. The concussions that I would see 10, 15 years ago, as a whole, they're very different to what we're seeing now. And we'll kind of go into my thoughts on why that is. So just some things to consider with head injury, that Hippocrates' quote is saying that no head injury is too trivial to ignore. You don't have to be Einstein to understand that concussions are bad for your brain. So I recently wrote a paper for the Canadian Pediatric Society, and it got a lot of press because it was asking Hockey Canada to push back the age at which body contact is initiated, right? And so I work with Hockey Canada now, and we're kind of talking about what our next step should be. But the other thing to remember with concussions, right, though, is that our brains are inherently strong, right? So even the Pope says evolution is real. So our brains have been getting concussions for, millions of years. So there is an ability for the brain to heal. I don't think I could go to work every day if I didn't think that the brain was, inherently strong. So I use a lot of different analogies, and one that I use with just concussions in general is that concussions are kind of like the ocean, right? You got to respect the ocean like you respect head injury, but you can't be terrified of the ocean either. If you're terrified of the ocean, you don't enjoy everything that the ocean has to offer. And the same thing with head injury. Too often I see, parents pulling their kids out of sport after one concussion, or not even putting their kid in certain sports for fear of concussion. So I think you have to have a healthy respect for head injuries, just like the ocean. All right. So with the brain and concussions, I don't think I'm smart enough to come up with this quote, but I really think that, there's nothing so well studied yet so really poorly understood, right? There's so much debate out there about head injuries, and, different camps. You have, people that are the deniers of concussions, and then you have extremists. But the way that I really look at concussions is it's this battle ongoing between the amygdala, your fight or flight part of your limbic system, your survival part of your brain, and your prefrontal cortex, the more logical brain. We'll explain that a little bit. A lot of that battle that goes on is between the conscious and the subconscious. And then the other thing very important to realize, and why I often tell patients that how I work at the University of Ottawa Brain and Mind Research Institute, is that the brain and mind are different things, right? So the brain's kind of like the hardware and the mind's the software. That's kind of the best analogy that we have. But even that is not a very good analogy, because the mind, and we'll explain this later, actually can change the structure of the brain. And there aren't any software programs that I know that can change the hardware, but the brain and mind are very different things. And we all touch on this again in the Reader's Digest version of it all. So this is a typical kid that I would see more recently in concussion. So 14-year-old female, healthy, very impressive kid, right? A provincial level volleyball, level 9 pianist, well-controlled ADHD, and got hit to the head, with the volleyball. Nothing, no loss of consciousness, no significant amnesia. It wasn't, to the degree of a car accident. So a relatively innocuous injury. And then they come to see me 3 months later, not in school, can't tolerate lights and sounds, can't tolerate any sort of exercise whatsoever. And this is kind of where, things have changed over the last 6 years. I used to see, one kid like this, once or twice a month. And at its peak, I was getting referred like 8 to 10 kids a day just like this. So what is going on in a species that has, have millions of years of practice getting a head injury? How can somebody have a relatively mild head injury like this, and not be able to function? If this was indicative of our species brain, then humans would not exist. And this is really the hallmark of persistent post-concussion symptoms, or persistent symptoms after concussion. So what we've seen really over the last 10 years is this prolongation of what concussions, with concussions just not getting better, and people are really struggling after head injuries. And I think this is why that trauma model, so when you talk about the concussion itself, it's not just a concussion, it's a traumatic event, and that with that traumatic event comes with it a lot of other factors that play into it. All right, so approaching the concussion. So when I look at concussions in these complex cases, I tend to break it down into 4 different factors that influence a head injury recovery. So first, you see there, number 1, we'll talk about all these, in depth in a little bit. That number 1 is actually the concussion itself. And when we talk about the concussion itself, that means that the head trauma has injured the neurons in a relatively predictable way. So that injury to the neuron is what we call the quote unquote concussion. Now, other factors that happen from a head trauma is some of those extracranial factors. Those are the whiplash injury, the jaw injury. Sometimes you get injury to your inner ear, which controls your balance, and sometimes even your eyes can be affected in other parts. So that's what I call the extracranial factors. And then we have a lot of other factors that can contribute to both the healing, but also the creation of symptoms after head injuries, right? And we'll talk about certain examples that I've seen. And then the other thing where I really have kind of focused my efforts and my research on is this kind of post-trauma neuroinflammatory response. And we will, again, give you the Reader's Digest version of this down the road. All right. So number one, this is what I show patients. So I'll actually draw this very crudely. And I'll say this even before I really get to know the patients, before I know how they hit their head. I say, you know what, I don't know how I hit your head or how you hit your head, but I'm going to tell you that I have a very, very good idea about what happened to your brain, because most concussions in humans and even, mammals, what happens when the brain gets concussed is very, very similar. So I'll draw this picture and say, listen, this is how our brain works. Our brain likes to keep potassium, right? Bananas inside the cell and sodium out, right? And so, and then it likes to have calcium outside of the cells. And then I'll point them to this little line right here, this long, straight road-like part of the structure. And I said, this is called the axon. And the way that the brain works is by keeping those finely controlled chemicals in check. So the way that the brain works is by allowing a little of that banana to come out of the neuron right here on this road called the axon, and a little bit of sodium in, and it goes in and out in a way we call it propagating down here about 200 miles an hour. Now, depending exactly how many bananas and salt was exchanged, that determines which little chemical is shot out the back end of the neuron. And that's essentially a very simplistic way of looking at how the brain functions. Now, concussions mess with that most basic functioning of the brain. So the first thing with concussion is you don't need to get hit to the head to get a concussion. It's all how your head moves or how it stops moving very quickly, because it's that movement or that slowing down that puts a stretching force on the neuron, and that actually damages the neuron membrane, which makes them leaky. So when these neurons get leaky, they lose the ability to control how these chemicals are supposed to be graded. And so what happens is you get all this banana that the brain works very hard at keeping inside the cells. It rushes right out and all that sodium rushes in. So the most fundamentally basic way that your brain works when you have a concussion is lost. Other things that happen, though, when the membranes of the neurons get leaky, you get calcium, milk coming into the neurons, and that associates with the neurons swelling. So when you have millions of neurons swelling, that can increase pressure in your head and give you headaches and all sorts of problems. Calcium also shuts down something called your mitochondria, which every grade 10 science book describes as the powerhouse of the cell. So that means that during a concussion, your brain loses its ability to make energy. So when it can't do that, you literally get a brain cramp, right? You release all this kind of lactate, and then you release some glutamate in there. And all these things essentially are very detrimental to how your brain functions. And so I'll draw this out and say, listen, I don't know how you did it, but this chicken scratch here, which is very messy at this point, this chicken scratch is what you did to your brain. Now, there's good news and bad news with this. The bad news is I can't give you anything to fix this. You've driven so far to see me, or you waited so long to get in here, right? But I can't give you anything to fix that. But the good news is you don't need us to, right? Your brain has plenty of experience at fixing it, right? So I know this is what happened to your brain. And I know from the moment your brain got injured, your brain is trying to fix it. Right. So your brain, when all these chemicals, because that's what a concussion is, it's just chemical imbalances. From the moment you got your concussion, your brain is in a constant state of repair. So it works by pulling all that banana back into the cell, pulling that sodium back out, so the brain can start working well again. The calcium gets pushed out of the cell, so the swelling goes down, so the pressure in your head should go down, so your headache should get better, right? And your mitochondria can start working without that calcium floating around, so you're making energy again, so you get energy to get rid of that cramp and to get rid of that glutamate, and bada boom, bada bing, your brain should be getting better. And this is why the definition of concussion is progressive sequential improvement. And that's not my definition. That's in, a lot of the textbooks, that concussion should get better progressively, sequentially, right? As these chemicals fix themselves, your symptoms should mirror that. But I very rarely see that. I see patients whose symptoms plateau. They stay the same. So even though the chemicals are fixing themselves, right, the symptoms don't change, or the symptoms get worse. The symptoms shouldn't get worse. If you overexert, they will get worse a little bit, but you shouldn't have these huge spikes in your symptoms unless you re-injure your head and you release these chemicals, right? And you shouldn't see these huge day-to-day variability in your symptoms if all of the symptoms were due to the concussion, right? So it's kind of like looking at a black eye is what I tell patients, right? You get a black eye, that's just chemistry too, that's chemicals, and you don't have a black eye forever. Granted that the brain is much more complex, but what happens with the black eye, it's blood being released, right? And that blood is dark, and then it gets broken down into something called biliverdin, which reflects green light, and then it gets broken down into bilirubin, which reflects yellow light, and that's why you have the black eye going from black to green to yellow and then gone. It doesn't go from black to blue to green to yellow to pink to orange. It's just not the way that the chemistry works, right? So when symptoms aren't getting better progressively sequentially, you got to start thinking about other things, right? And yeah, some of those things could be the extracranial. So if as part of that head injury, you got a concussion, but you also had a whiplash injury, and that whiplash injury was not corrected, then yeah, you are going to have headaches possibly indefinitely until that is resolved, right? Same thing with temporomandibular joints. So a lot of boxers, right, they have temporomandibular joint problems. That's associated with headaches, right? So anyway, for those chronic cases, it is imperative to get a good allied health professional involved to kind of work through some of these whiplash, TMJ, the dizziness, all these different things. Now, all of these things here are diagnoses that I've made, right, that patients have come to me for a concussion that did not get better like it was supposed to. So, because you can look at it, undiagnosed ADHD, you're going to have significant focus concentration issues that were there, but the concussion did make it more challenging. And so it's only a big issue now. I've had kids with chronic anemia. Kids have developed mono when they're head injuries. I've had all these different things here. So when the concussion isn't getting better, you do really need somebody who's well-versed in kind of identifying, testing, and diagnosing these other conditions, right? And I'm on a lot of national boards for concussions, and there's debate about, who should be managing concussions. And definitely in these, in these chronic difficult cases, you really do believe, I believe you need a medical doctor, because there's so many other factors that need to be addressed. Now, the other thing, right? This is what we were talking about before, about this post-trauma neuroinflammation, right? So really, it's a battle between these two different parts of your brain that we'll talk about in a minute, the amygdala and your prefrontal cortex. But this color here, this color scheme here, this is from 1936 from a McGill doctor. Really interesting story how he kind of stumbled on to, he was one of the first researchers really to look at the systemic effects of stress, right? But this is, when I explain it to patients, I explain this is kind of like your mind, right? I've told you a little bit about the brain with the neurons, and at this point, typically I'll explain the amygdala and the prefrontal cortex in more depth with the patients, but this is the mind, right? So this is how the brain works. So in this green zone, this is kind of the ideal state. This is when your mind is calm, right? This means that there is no stress, there is no trauma, you're not in pain. For the kids that I see, I tell them it's like, you like school, school likes you, you like home, home likes you, you're eating well, sleeping well, getting good exercise, like the whole world is just great, you're calm. Now, yellow phase here, this is the trauma. This is head injury. This is where the concussion would be. This is the thing that puts you into the fight or flight response. Now, the only reason we have a stress response really is to stay alive, right? That's why we have this stress response. Now, unfortunately, in today's world, we have a lot of triggers that put us into the fight or flight that aren't really a threat to survival, right? So I always tell my patients the thing that puts me into that fight or flight response is when I run late. So when I run late, I go into that fight or flight mode. And I am pretty sure I don't need this response, as my patients are not going to try to attack me, right? But it doesn't matter. I go into that fight or flight mode, which is this orange zone. And this is where you're releasing all these glucocorticoids and all these chemicals that are really hard on your body. We're only supposed to be in a fight or flight state for about 30 minutes, right? And that makes sense, because if you look through evolution, right, fights didn't last 30 minutes, right? Or if you just ran away for 30 minutes, well, you were probably far away, but the chemicals, the glucocorticoids, the catecholamines, these chemicals are really hard on the body. And if they're there too long, you start to burn out, right? Now, Hans Selye in his description got a little bit wrong. We don't necessarily get adrenal fatigue, but it is very hard on your body. And so there's this field of study that I'm really interested in now called the psychoneuroendoimmunology, which is just how all your major body systems interact, right? Whether it's your neurologic system affecting your hormones, and your hormones affect how you feel, and how you feel affects your immune system affects your neurologic system. So everything is just intertwined. So where are these long kind of symptoms coming from? Well, a lot of it comes from this pre-existing state where our minds are not at peace, right? We are perpetually go, go, go. Our brains are overstimulated from technology, right? And we have this elevated baseline levels of glucocorticoids, and then we get a sudden insult, right? And in some cases, it's that big head injury that is an injury to the brain, but it triggers a systemic effect in the whole body, which will then burn you out. All right, so I don't think we have time to really go through this, right? But I do want to talk to you a little bit about the prefrontal cortex versus the amygdala, right? So the prefrontal cortex, that's the front part of the brain, last part of your brain to develop, right? That is the part of the brain that allows you to do the right thing when the right thing is the harder thing to do. This is, for instance, kids with ADHD on average are smarter than kids without ADHD, but their prefrontal cortex is 2 to 4 years slower to grow. So it's that much harder for them to sit still to do the right thing. So they might be the smartest kid in class in grade 3 as an 8-year-old, but if they can only focus like the junior kindergarten down the hall, doesn't matter how smart you are, grade 3 is going to be a problem. So that's all the prefrontal cortex work. And we do know, guys, indirectly that get concussions and head trauma do affect how your prefrontal cortex functions. And this is why I do a lot of talks for different companies, because we talk about prefrontal cortex dysfunction and how that can really mimic and look like ADHD. Now, if we're not thinking with our prefrontal cortex like good humans should, working 9 to 5 and living with other 8 billion other people, then we might be more amygdala driven. And our amygdala are about this big, almond-shaped structures that sit in the back of our brain, kind of like our spidey sense, right? Everybody knows Spider-Man's spidey sense. This is a thing that's always turned on in the background, looking for something, right, that is going to try to kill you, right? So this doesn't want you to be calm and relaxed and a good human. This wants you to be perpetually agitated or on edge or easily worried or anxious or nervous. So you have these two different processes just kind of going at it. The prefrontal cortex say, yep, we live in Canada, we're relatively safe, right? No more saber-toothed tigers around. And then that amygdala kind of talking in the background saying, oh, no, there could be saber-toothed tigers around. Running late is a very terrible thing, right? Or that big presentation that you have coming up, right? Or that big test that you have, right? This is a very important thing and you got to give it your best or something bad is going to happen. And just that thought process can trigger you into that fight or flight mode, just like a concussion will, right? So if you're looking for more in-depth information on this, this is a really good study, right? Without going into too many details, we know that when you have a concussion, your right amygdala middle lobe becomes activated automatically, right? So, and that makes sense because if you got a concussion 10,000 years ago, well, you better ready to fight for your life because likely there was something trying to kill you. So I tell these kids, I don't know how you hit your head yet, but I'm going to go out on a limb and say that, it wasn't 10,000 years ago and your concussion wasn't caused by a saber-toothed tiger, but our bodies respond in a very similar way in today's world as it did then, and that is no longer a good thing, right? So when you get chronic stress, these glucocorticoids, it does actually start to affect the brain. And this is what I was talking about before with the analogy, the brain's the hardware, mind's the software. It's not a great analogy because the mind, you can see here, when you're caught in that perpetual fight or flight cycle, it actually does change the structure of your brain. All right, so we talked a little bit about this, right? So when you get a head injury, right, the amygdala is overactive, right? And that can shut down how your prefrontal cortex works, right? So it can be very, very hard in the chronic patients to try to determine, all right, are these symptoms more caused from a damage to the neuron, or is it coming from an overactivation of the amygdala? right? So I want to talk to you a little bit about this because this is it's important for everybody to understand that, all right, when the amygdala gets activated, remember the amygdala is only supposed to be activated if there's something trying to kill you, something very dangerous around. So you got to think of the body's response to concussion in this term. So when this happens, your pupils dilate, right? So some people say, well, if you have a head injury, look at your pupils, and if your pupils are big, it means you have a concussion, and that's certainly not true. If you break your leg, your pupils are going to get quite big as well. If you have raised intracranial pressure in your brain, right, from a brain bleed, then your pupils will dilate. But it's not necessarily the concussion, the changing of the potassium and the sodium and all that stuff we talked about before that causes your pupils to dilate, right? But an amygdala response, part of the amygdala response is makes your pupils dilate. And that used to help us see better at night a long time ago, which helped humans survive. So when we were injured or we got a concussion, if our pupils got big, that helped us see that saber-toothed tiger, right, approaching at night. But in today's world, we get concussions and our pupils dilate and we're subjected to arena lights, classroom lights, fluorescent lights. Well, that's where a lot of light sensitivity may come from. Now, some kids with head injuries or pupils dilate, they don't have a light issue, but it's more of a hearing thing. But it's for the same reason, right? If you get injured, right, you want to listen for that saber-toothed tiger coming around. So when you have enhanced hearing and now we share the world with 8 billion other people or we jam 30 kids in small classrooms, that's a lot where the hearing sensitivity comes from, right? So does the hearing sensitivity come from potassium, sodium, altered brain structures in other places, or does it come from this response? It's hard to know, right? But the problem with the amygdala, though, it lights up not only when you're injured and when you're stressed or when you're in pain, but it lights up whenever anything is different. So transitions are not good. But if your brain is perceiving too much light, too much sound, well, you start seeing this cycle develop. The amygdala's like, too much light, too much sound. This is not good. I got to stay in this kind of hyper aroused state. And again, all this is happening subconsciously, right? Other things that happen when the amygdala turns on, it tightens up your muscles, right? Because again, you want to make sure that you're ready to fight or to run. So we know that when the amygdala is engaged, you develop what's called en blanc posturing. So you're more likely to turn from your hips than you are to turn from your neck. And this also can lead eventually to neck pain, back pain. And we know that a tight neck does lead to headaches as well, too. Now, if you are sending more energy to your muscles, right? And again, if you think of kids with ADHD, right, they're a little bit more amygdala driven. And this is why they're very fidgety. They'll pace a lot because their muscles have all this energy, which again, energy in muscles is good if you're trying to run for your life, trying to survive, but not good when you have to sit 6 to 8 hours. Now, we know too that energy in this universe cannot be created or destroyed. It's just moved around. So if you are sending energy to your muscles, where are you taking that energy from? Well, you're taking it from your brain. So we know that when that stress response kicks in, the blood vessels to your brain constrict just a little bit, right? And the brain, give or take, needs about a liter a minute, right? Well, you are going to be creating headaches and dizziness. But the other thing is, there's a very thick nerve connection going from our amygdala to our vagal nerve. Our vagal nerve is called the rest and digest nerve. Vagal is Latin for wandering. We have these two long nerves that come from the back of the brain that go to the belly. And you're not really worried about digesting food, right, if you are in this kind of fight or flight state. So this is why a vast majority of abdominal pain in kids, we don't find out the cause. So when I do get kids referred to me for abdominal pain, I'll do a big workup, try to figure out what we can, but, a significant portion, you don't find out the cause. And that pain is real. It's not psychologic. It just comes from a nerve that travels from the back of your brain to your belly. Now, I ask kids too, if you are in your cave and there is a saber-tooth tiger outside your cave, how are you going to eat that night? Well, or how are you going to sleep that night? So you're not going to sleep very well. So this is where insomnia comes from, right? And insomnia, there's a study came out that said 85% of concussion symptoms past 12 weeks is better attributed to sleep problems than to the concussion. And think about it, if we put a couple of nights of bad sleep together, our focus is going to be worse. Poor sleep is the second most common cause of headaches, right? So concussions and head trauma affect sleep, and sleep causes a lot of different symptoms. And then the other thing that happens when the amygdala turns on, it shuts off your prefrontal cortex. And so, because this is when there's a true threat around, you don't want to be a good human. You want to be reactionary, you want to be impulsive, you want to be agitated, you want to have ADHD. So I tell patients that, I don't have ADHD. My wife thinks that I do, but I'm pretty sure that I don't. I think my prefrontal cortex was formed on time, right? But when I'm running very, very late and my amygdala turns on, I look very much like I have ADHD, or for this case, very bad concussion symptoms, right? I'm very distracted. I'm more impulsive. I'll run to my office, don't know why I went there, because that's the prefrontal cortex shuts down. So you can see it can be very tricky, right? Where the symptoms are coming from. Is it coming from an injury to the neuron, or is it coming from an amygdala response, or something else altogether, right? So I'm seeing that I'm running a little bit long here, but this comes back to this symptom. So when I see patients, right, and there's lots of studies, you'll see these down in the corners, and there's many, many more, that the key to get better after a head injury is to get the mind to be quiet, to decrease, to extinguish that fight or flight response that's happening, that's causing headaches, that's causing sleep problems, that's causing neck pain, right? Because I can't fix the concussion anyway, but your brain can do it if the mind is good, right? Now, what happens is, though, is with today's world, right, we have so many kids up in this kind of orange zone who their mind is, already overstimulated. Up to 80% of kids feeling anxious at least one time a day. So what happens, and this is what is called the two-hit hypothesis, or the double insult hypothesis, is that you get people that are already in this orange zone, whether they already have a concussion, or they have pre-existing anxiety or stress or past childhood trauma. So their amygdala is already heightened. And then you come in with another trauma like a concussion, and you don't go from a nice, calm, happy, content amygdala state to slightly elevated. You go from a prime state to really elevated, right? And this means that your symptoms are going to be that much worse. It's going to be that much harder to get better, because it's that much harder to get the mind to calm down, to back in the green zone. Because you can't be in the green zone if you're having pain all the time. You can't be in the green zone if you're not sleeping well. You can't have a calm mind, right, if school's not going really well or work's not going really well, right? So you can see everything is pretty much intertwined, right? And this is like, who's most likely to get prolonged symptoms out of a concussion? Well, the number one predictor in some studies is pre-existing anxiety, right? But really, you have these high achieving, teenagers, like I showed you in the case before, right? But really, anybody that's in this orange zone, right, they're at risk of having prolonged concussion symptoms. All right. And this is kind of the brain and the mind, right? And this is what we talk about. You can't cure the brain from a concussion. We talk about some supplements and some vitamins, what have you, but really it's controlling that mind and restoring the balance between the amygdala and the prefrontal cortex. All right, we're doing good. We got through the first bulk, and we got another 10 minutes or so, I think, to talk about the next stage. Now, a lot of talks that I do now is actually on technology, right? And I kind of equate it to smoking in the 1950s. In the 1950s, we didn't know how bad smoking was, right? Doctors were smoking with their patients, pregnant women were smoking in restaurants, we're smoking in, airplanes, right? We just didn't know. And now it seems absurd, right? How ridiculous, that was. But to me, equally ridiculous is, 12 years ago, we had baby Einstein, which, it was said that your baby watches this, right? Your baby will be a genius. And we know now that how absurd that is. We know that the more screen time babies and infants gets, the more likely they are to be diagnosed with developmental delay and ADHD when you're older, and even autism. We know that the earlier kids get cell phones, the more likely they are to be depressed. We know that the more screen time kids have, and this is an opinion, this is fact now, the more likely they are to be diagnosed with ADHD, with anxiety, with sleep problems, with pain problems, with fatigue problems, right? So, but it's hard, right? Like the technology, it's addictive, right? It does light up our nucleus accumbens, right? And these devices, the video games, they do light up our amygdala, right? And so it feels good. We're distracted, we're stimulated, but just like cigarette smoking reconfigures your lungs, we know, and this is a talk amongst itself, that too much technology, those overstimulating technology, can change the structure of your brain. So just going to put that plug in. Anybody that's watching this, you have to really consider, technology as a major player in our kids' mental health. All right, so managing concussions. I just want to take kind of my approach here over the last 10 minutes or so. To manage concussions, right? So if you ever see somebody gets a concussion, right? In the medical world, it's well known that you first stabilize them. But what most people don't know is that a head injury is a neck injury until proven otherwise. When I used to work in the emergency rooms, we would see kids coming in with head injuries and nobody looked at the neck injury. And unfortunately, I've seen some significant neck injury myths. So just don't forget that, right? Now, warning signs with a concussion, right? If after a couple of hours the patient can't wake up, right? Now, we don't think that you need to wake up patients every 2 hours like we used to, because if you feel that you need to wake them up every 2 hours, well, then they should be in the hospital being monitored for that, right? But you are worried for worsening fatigue at a different time of the day, right? That is a potential risk factor for a brain bleed. Worsening headaches over hours, if they start building again, that's signs of an intracranial bleed. Really, 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 really tired, almost like they're intoxicated or very, very confused. Otherwise, if they get really restless and agitated, or if they have seizures, obviously those are red flags. Difficulty with vision, primarily double vision, or not being able to see, those are some red flags. Vomiting, if they vomit a couple of times, they develop a fever, a very, very stiff neck. Obviously, if they lose control of their bladder or the bowels, that's a risk factor. But often people underestimate the effect of what those stingers are. So that's when we talk about things shooting down your arm. That's actually a high risk factor for a nerve injury in the neck as well. So you got to be careful about that. Now, if you have a head injury, we don't like getting CT scans. CT scans have about 300, is equivalent to about 300 x-rays in terms of the radiation. So we don't want to radiate people if we can, right? Outside of 48 hours, you should really be trying to get an MRI if you're worried, right? But within those warning signs that I showed you last time, that would be an indication to get a head CT, and because you can pick up a brain bleed there. All right, so when I manage patients to initially educate them well, you want to make sure that they don't cocoon, so you don't shut them down and lock them in their rooms and slide food under their door, right? You got to get them kind of out there in a very safe, supported way, right? So make these patients feeling support is very, very important, right? All right. So some of the basics. If you're first concussed, you got to optimize your sleep, you got to optimize your eating, you got to maximize your hydration, and you got to make sure that they know the detrimental effects that stress can have on the recovery, right? So those are the big things that I try to say initially. Now, with kids, I used to see kids that would be out of school for months, right? And thankfully that doesn't happen too much anymore. We do think that kids should be back in school with just a boatload of support. I typically say, yeah, get them back in body, not in mind, within 48 hours, right? Longer than that has been shown not to improve outcomes, and actually can make things feel worse, because kids start getting socially isolated, they start falling behind in school, they start getting stressed out, and it just makes everything worse. Now, they go back to school, and there's some really good templates out there for back to school forms, but you don't want them doing too much when they go back there, just to be there in body, not in mind, right? And then return to activity. We want kids to not shut themselves down. We know how beneficial exercise is for your mood, but there's also good studies coming out now too that it's good for your brain health, right? So we want to make sure that you get back to activity, a safe activity, just walking, stretching initially, and then build that up gradually. And there's lots of guidelines out there as well too that explain how that is, but we don't want to shut people down. Get them outside, get them getting the sun, their vitamin D, get that blood flowing. All those are very good for your brain and your mind. All right, so some initial interventions you can do. Yeah, really push the drinking, protein heavy, low sugar diet. If they're very, very dizzy and their blood pressure is low, sometimes you add a little bit of salt in there. In terms of their sleep, you want to avoid napping, right? You're better off falling asleep at 6 and sleeping through the night than you are taking that long 2-3 hour nap. If you need to take a 30-minute nap, okay, but not too much more than that. Early walking and stretching is what we talked about before. Now, I have a very low threshold to put kids on some supplements, right? Now the problem with the supplement industry, yeah, it's a $40 billion a year industry with very poor oversight, so you got to be careful. But omega-3, there is some literature behind it in terms of helping with head injury recovery, but it also helps with focus and potentially behaviors and mood. But you need a pretty high dose of the DHA EPA up to 3,000. So you need to go off into the specialty nutrition stores, the Cardishes of the world, or the natural food pantry, those type of things, right? Reestablishing a sleep cycle with melatonin is a good idea. There's actually some studies, I was involved in one, that we think melatonin can help your brain recover independent of the sleep benefit through this GABAergic system in your brain, but it can also just help regulate your sleep schedule. So 3 to 10 milligrams, 30 minutes before bed for a couple of weeks is okay. And then we kind of hijack some of the headache literature, of which magnesium coenzyme and riboflavin B2 has been shown to be helpful with headaches. So I like magnesium a lot. It helps with sleep, it helps with stress, helps with headaches, and the only side effect really is that it keeps you regular. It's a little bit of a laxative. Physios, you don't want to do physios right away, but after 10, 14 days, right, getting a physio involved might not be a bad idea. All right, so this is just some information on sleep hygiene. I don't like it when patients are on melatonin every night chronically, right? But in short bursts, we do think that it is relatively safe in short periods of time at a low dose, right? When you're dealing with headaches, you got to make sure, guys, that you look for your triggers, right? So is it poor sleep? Is it too much light? Is it stress? Is it hydration? The other thing, you want to make sure you're not taking Advil or Aleve or Tylenol more than 12 days a month, because you can get these over medication / rebound headaches, right? So if I don't get coffee in the morning, I get a little bit of a headache, right? And that's part of that rebound effect, right? And in terms of headaches too, you want to look for all the other factors that can go into to headaches. It's amazing how many people haven't gotten their eyes checked in years. COVID came and it was shut down, and the optometrists in Ontario went on strike. So some people have gone years without getting their eyes checked, and that obviously plays in with headaches, right? So those persistent, yeah, we've got a couple minutes left here. So those persistent concussion symptoms, it's when they're not getting better progressively and sequentially. The symptoms just really, really fluctuate, right? Not really based on any sort of exertion. They tend to be more based on, maybe stress levels, right? And it's not as predictable as you want to be, right? But those patients, you really want a multidisciplinary team, and you want a medical doctor kind of heading that up that knows what they're doing. But it does start with optimizing sleep, eating, and your stress management. So the best advice I can give, right, is get in that green zone, right? But as immortal words of Kermit the Frog, it's not easy being green, right? So when I see patients, I see them once, they come back typically a month later. If they're not that much better, we get blood work, right? Looking for some of these other things. They should be plugged in with a physio at that point. And if after a month and they're not better, there are medications that we use. It's all considered off-label because it's not really studied. But again, we use medications that not for the concussion, but just control the symptoms. Maybe medications that will help you sleep, or medications that will help your headaches, or medications that help with energy or focus or concentration. Whatever it is, there's medications that, we try to get them in the green zone by taking away the symptom that is keeping them out of the green zone, right? But yeah, physio should be involved, and we should get them exercising a little bit. MRIs, concussions at this time do not show up on MRI. So if any doctor does order an MRI, which most times we don't, you'd be looking for something different and weird, right? One thing when you do have chronic concussions, somebody, don't just think that they're like this because of the concussion. The concussion might have started the process, right? But there's typically other factors that we can treat that are bigger contributors at this point. So we talk about that 3P approach, right? This is how I manage concussions. So first P is physio, so getting good allied health professionals involved. The other one is the psychologic, right? So we'll talk about this in a minute here that, yeah, we have about 70,000 thoughts every day, guys. 70% of them are going to be more negative, right? So it can be hard to break that cycle when our minds are just kind of spinning and busy all the time. But this is what I tell patients, right? My 3 rules of 1+2. So to get in that green zone, whether you have a concussion or not, you should shoot for 1 hour of physical exercise a day, maximum 1 to 2 hours of toxic screen time. So that does not include school-based screen time or even cuddling on the couch watching TV with your family. That is including FaceTiming grandma and grandpa, all right? 1 act of mind training, so 1 act of meditation. So doctors have a reputation of pushing meds. We don't push meds, we just push things that work, right? And meditation, there's so many studies coming out how beneficial that it is, right? And then you got to fuel your body well, right? Staying well hydrated, right? And eating the healthier foods, and then sleep. And then, yeah, we do a lot of different counseling. We recommend counseling, whether it's how to deal with chronic pain or how to deal with your loss of your sport or how to deal with, all the stressors that have come with missing school, right? But we really try to, support these kids in any way that we can. But yeah, just mindfulness has been shown to shrink your amygdala, increase the blood flow to your prefrontal cortex, increase the size of your hippocampus, right, which helps you remember things, right? So mindfulness works, right? It's just, it's boring and it's a tough sell for kids, but it's super important to get that going. And again, different physios, we get home exercises going. Sometimes we recommend massage therapy, occupational therapy, physiotherapy. There are these special glasses, weighted blankets for sleep. There's just lots of different options out there. And then, yeah, from a pharmacological perspective, we talked about a couple of them. That's going to go beyond the scope of this talk, but we do use lots of them, right? But I always tell kids where they come see me for ADHD or anxiety or concussions, you are the captain of your ship. Where that boat goes, it's because the captain takes it there, right? Your parents, they're kind of like your crew, right? They are there to make sure your boat doesn't sink, but they don't steer, right? And then doctors, physios, psychologists, we're kind of like a lighthouse, right? We just there to try to point you in the right direction, right? If there's rough waters and the captain doesn't want to steer, right? Or if the captain wants to steer the boat right into the rocks, there's nothing that the lighthouse can do, and the crew has a hard time stopping. So it really is the captain of the ship. It's not the medications necessarily that helps or the physio. It's the kids, and they've got to be willing to really, really kind of work hard and do their mindfulness, lower your screen time, all those different things. Right now, medications, when we use them, the analogy is, yeah, so some boats are made to use sails, some brains need meds, right? Others don't. They're just made differently. One's not better than the other. But just because a boat has sails, that it needs sails, doesn't mean it's going to go where it needs to. You still need the captain, but it's hard for a boat that needs sails to go where it needs to if it doesn't have them, right? So that's where, sometimes medications are needed, but only in the context of everything else. All right. I think I'm kind of right on time today, which is good. So this is a good quote about from the World War. I think it's appropriate with concussions, right? So after a big battle, Winston Churchill said, "Yeah, everybody was saying the war is over." He says, "No, it's not the end. It's not even the beginning of the end, but it's perhaps the end of the beginning." And I think with concussions, we're kind of there, right? People respect concussions, but we just still have so much more to learn. Thank you very much.